Ariadne Labs has been called in to respond by translating the latest scientific evidence into best practices and simple, actionable recommendations as the COVID-19 pandemic evolves. Ariadne prides itself in understanding the gaps that exist in healthcare delivery and in our ability to research what can work to close those gaps. At Ariadne, we use principles of the Ariadne Labs Innovation Arc to develop recommendations and interventions to help improve healthcare delivery. Our Ariadne Arc represents a successful process of comprehensive background research, intentional design, rapid testing, continual learning and collaboration, and the ability to spread solutions. Solutions can be many. They can be recommendations, checklists, implementation approaches to help close healthcare delivery gaps. Applying this methodology to help prevent and treat COVID-19 has been our immediate goal. So one area that we're focusing on is caring for elder adults. Older populations are at greatest risk for the worst effects of COVID-19, particularly the more than 2 million people living in nursing homes and long-term care residential facilities. In addition to the higher morbidity and mortality that older adults are more prone to, they're also more prone to loneliness and social isolation as a result of the social distancing that we've employed, which have been necessary to slow down virus transmission. At Ariadne, we have identified essential principles necessary to improve the care and the well-being of these high-risk communities, particularly elders living in skilled nursing facilities. These include 1. Promoting testing and tracing of patients and staff in long-term care facilities. 2. Supporting facilities to develop and execute a strategy to enable care planning and address staff shortages. 3. To promote conversations with patients about their values and goals to help inform clinical medical decision-making. 4. To provide guidance and resources to maintain patient mental health and to prevent loneliness and isolation. And 5. To focus on a more holistic well-being approach for residents living in long-term care facilities. We'll be using the Ariadne Labs Innovation Arc to develop recommendations and interventions to help long-term care facilities care for older adults. The pandemic is exacerbating and amplifying already known issues for seniors, loneliness and isolation. We're very concerned that our living and our support systems are inadequate right now for such seniors, both in institutions and at home. Will feel much more isolated as we continue in this pandemic. We're recognizing, however, that there are bright spots. There are facilities who've worked with interesting practices to help alleviate isolation. Some institutions, for instance, have used regular testing to cohort COVID-negative patients to promote social interactions. Others have used social services and food delivery and even paramedics to check on those isolated as a result of the pandemic. There's use of telephonic and online visitation. It helps, but it's really not a cure-all, as technology is very limited compared to actual face-to-face encounters. What Ariadne Labs is doing right now is researching these best practices, and we're writing an evidence summary which will really be a briefing to help share and communicate these successful efforts to alleviate social isolation and loneliness.